that. So thank you. Yeah, back to you, Dr. Eksteen.
Okay, thanks, Daniel. Good morning, everybody. I'm going to start. I don't know if there's some people still logging on, but I'm going to start anyways. So I'll be doing a scene case and a presentation on allergic rhinitis today. So let's fire away, start with a used case. So this is a gentleman, Mr. A, that I saw a couple of weeks ago. He's a 42-year-old gentleman who presented basically, as you can see in this picture, he presented with red, itchy eyes, also a very runny, congested nose, also itching, sneezing of the nose, and then also a very scratchy throat and complaining of having a post-nasal drip and having a dry cough, especially at night, and then also complaining of having blocked ears. So according to him, his symptoms started about a month ago after he just moved to a new house on a farm where he is exposed to a lot more dust than usual. Just asking about other potential allergens, he also said that they have 2 dogs and then recently got a new cat when they moved to the new house for his daughter. And then he also gives a history of regularly suffering from hay fever and problems with his sinuses, and also he was treated as a child for asthma. As you can see, his vitals are all within normal parameters and clinically the patient was stable. So just the diagnosis I already gave you in the beginning of the presentation is allergic rhinitis. So what is allergic rhinitis? So in layman's terms, it's basically the same as hay fever. And why is it important for you to know this about this in your clinical practice is because it affects a massive amount of our patient population. So about 20% of our adults and 40% of our pediatric population will somewhere in their life be affected by allergic rhinitis. Although it is not a life-threatening disease, the morbidity has quite a significant impact on the quality of life of patients. And then it also has a massive financial burden on the global economy where it costs about $11.2 billion each year. So let's just quickly talk about the disease process and why certain people do get allergic rhinitis and others don't. So to sum it up, the disease process is basically inflammation of the mucous membranes of the eyes, the nose, the ears, and the throat, although the nose is the most commonly involved organ. There's also a big genetic component, which means that if there is a very strong family history, then the chances of the patient sitting in front of you also to have allergic rhinitis is very, very high. IgE, you will see I mention IgE quite a bit. This is just a specific antibody in the body that fights against allergies or causes an allergic reaction. So what happens when someone develops allergic rhinitis? So a susceptible individual, this might be someone with a genetic predisposition to getting something like allergic rhinitis. When they are exposed to an allergen or a foreign protein, this will initially not always cause an allergic reaction from the get-go. They usually first get an allergic sensitization after the first exposure, which then produces a specific antibody IgE, which is directed against these specific proteins. And this specific IgE then goes and sits on all the mast cells in the nasal mucosa. So when the patient gets exposed to the same allergen again, this is now where an allergic response then kicks in, or where you get allergic rhinitis. So they divide the disease process in an early or intermittent phase, and then also a late or more chronic phase. So what happens in the early or intermittent phase is where a patient gets exposed to a specific allergen, the IgE that was already produced with the sensitization then causes an allergic reaction or an inflammatory reaction with an increase in or massive release of inflammatory mediators. And these inflammatory mediators are the culprits. They cause all the symptoms. So they will stimulate your mucous glands to have an increased production of secretions. As you can see in the picture, I've illustrated there, you can see nicely there's swelling due to vasodilatation, which can then cause congestion and pressure again in the nose. And then also they have an increase in their blood vessel permeability. So there's swelling also of the surrounding tissue. And then sometimes when the sensory nerves are stimulated by the inflammatory mediators, this can then cause sneezing and itching of the nose or the eyes. So the late phase of the disease process, this basically happens over the next 4 to 8 hours after a patient has been exposed to an allergen. This is where there is an accumulation of your inflammatory markers and causes a massive continued inflammation in the upper airway or the eyes. The symptoms are basically the same as with the early phase, although there is a bit less sneezing and itching, and patients usually complain more of congestion and a runny nose or mucus production. This phase might persist for hours, but sometimes it can last up to days. So the long-term effects of your allergic rhinitis, if it is neglected or not treated properly in the specific phase, then you can get systemic effects. And this is basically because of an ongoing inflammatory response that can cause fatigue. Patients might feel sleepy or just generally unwell. And these are the symptoms that cause the patient to have an impaired quality of life. So let's just quickly touch on the specific triggers for allergic rhinitis. So I thought this was quite a nice summarized illustration of what the most common triggers are. There's obviously a whole long list of triggers if you go and do a bit of research, but I think these are the most common. So surrounding irritants in your immediate environment includes something like dust and dust mites, might be mold, secondhand smoke. If there's pets, then the pet hair, pet dander can be a trigger for allergic rhinitis. Seasonal factors, I think this is probably the most well-known trigger for allergic rhinitis is with seasonal change. So usually in springtime, when there's a lot of pollen in the air, this is when a lot of people complain of symptoms. And then certain food allergies might also cause allergic rhinitis symptoms. So something like milk, eggs, wheat, peanuts, there's a whole long list of them. If we just refer back to our case, Mr. A, I think in his case, if you remember, he just recently moved to a farm where there's a lot of dust. So if you have to put your money on a possible trigger, it will probably be dust and dust mites. And then also the new cat that he got for his daughter. So cat hair might also be his trigger. So how do these patients usually present? I think we have touched on some of the symptoms. So you can divide it into eyes, nose, ears, and throat symptoms. So if we start with the eyes, patients might complain of red, itchy eyes with increased tearing of the eyes. And also itchiness of the eyes. Then the nose, they might complain of itchiness of the nose, a runny blocked nose, congestion of the nose. And then also I'm going to put in here sneezing. And then if we go to the ears, patients might complain of feeling having blocked ears or having tinnitus in the ears, having a fullness in the ears. And then to the throat, here patients might complain of having a postnasal drip, a scratchiness of the throat. And they often, if they do have a postnasal drip, patients might complain of having a dry cough, especially at night, that is not otherwise explained. Then if patients do get complications or complicated allergic rhinitis, they might even present with symptoms like headaches, or sinusitis with fever, etc. And sometimes if the patients have an extremely blocked nose, they might have problems with mouth breathing or snoring. So on physical examination, what do we look for? So it's quite a focused physical examination, focusing basically on the organs mentioned. So the eyes, the nose, the ears, and the throat. I included this picture in this slide because I think this is typically what you will see in a child with allergic rhinitis, or I want to say ongoing untreated allergic rhinitis. So let's start with the eyes. You will often see that patients have red conjunctiva. They might have extreme swelling around the eyes. You can look for Denny Morgan lines, which are just fine lines underneath the eye. And this is because children often, they rub their eyes because the eyes are itchy, the eyes are tearing. So then you can see these Denny Morgan lines. Then you can also look out for allergic shyness or dark circles under the eyes. This is usually because of the vasodilatation due to the inflammatory reaction of the disease process that causes the allergic shyness. You can also, at the nose, when looking at the nose, you can sometimes see a nasal crease. And this is typically because children often, what they call an allergic salute. So they swipe, because the nose is itchy and runny, they will swipe their nose upwards with the hand. And then doing this for a long period of time eventually causes a nasal crease. Our evaluation of our patients usually start with them walking into the door. So what we often see is children with who are mouth breathers. So you will often hear them breathing through the mouth and not the nose, especially in our younger children where they are more prone to being nose breathers. So you will often hear them breathing through the mouth. And if this has been a thing that has been coming on for some time, then sometimes you can even get complications like an overbite or a high arched palate. And then if you do look inside the ears, you can sometimes see that there is a fullness or abnormal flexibility of the tympanic membrane. Looking inside the throat, you might often see that the tonsils are enlarged. Yeah, I think those are the most common things that we often look out for. If you look inside the nose, very, very rarely, you might see nasal septum deviation or perforation, but this is very, very rare. I've actually never seen it because of allergic rhinitis. It's always some other condition as well. So how do we make the diagnosis? It's usually a clinical diagnosis. So on history and examination, you can with certainty make a diagnosis of allergic rhinitis. If we want to confirm a specific allergen, then there are a couple of tests we can do. So one of them is an allergy skin test. This is what the gold standard was a couple of years ago. They used to do this. So what it basically entails is, that's the top picture that I've included in the slide. So they will use the inner aspect of the forearm, and they will number on the arm. They will draw lines with a permanent marker or with a marker and just make numbers so that you know what specific allergen you are putting at which number. So they will take a drop of the allergen. So say there's an allergen for cat hair, for pollen, for peanuts, etc. They will put the drop of the allergen, specific allergen, on the skin, just make a small skin prick so that the allergen is introduced subcutaneously, and then you just give it some time to see if there's a skin reaction. So you will look for a wheal and flare reaction of the skin, and the size of the skin induration will then give you an indication of whether the patient has a specific allergy towards a specific allergen. This has mainly been replaced now recently by the RAS test, which is a blood test that we do, which basically works on the same principle, but instead of pricking the skin, you basically take a tube of blood, and then they mix a drop of blood every time with a drop of the allergen, and they test the amount, or if there is an abnormal increase in the amount of IgE antibodies, and this will also give you an indication of whether there is an allergic reaction or not. In very severe cases, you can consider doing imaging, but this is usually for our patients where you suspect complications like sinusitis, etc. So I'm not going to go into too much detail on the differential diagnosis, but I think it is important to know that there are other conditions that can present basically the same. I think the one thing that often catches us as healthcare professionals out is sinusitis, because allergic rhinitis and sinusitis often presents with the same symptoms. So just to keep in the back of your mind, always think of sinusitis. Sinusitis is also a complication of long-standing allergic rhinitis. Then you will see in the list, there's also rhinitis medicamentosa. This is a condition that we often create, or we are the cause of it. And this is because of certain medications that we give patients. So our topical decongestants or nasal spray, decongestant nasal sprays like our Iliadin, if you use that for longer than 3 to 5 days, that can actually cause a paradoxical rhinitis. So it can actually cause a runny nose if you use it for longer than indicated. Certain antihypertensives and then cocaine abusers can also get rhinitis. And then interestingly enough, some of our hormone conditions, so pregnancy, thyroid conditions, certain oral contraceptives can also cause a type of rhinitis. And then just to mention, if you ever get a child with rhinitis symptoms, but only in one nostril, then often there is a foreign body or a nasal polyp in the nose, or it can even be a tumor, but tumors we often see in adults more than in children. So always just keep an eye out. If there is a history of trauma, always think that there might be a cerebrospinal fluid leak. Yeah, I think these are the most important differential diagnoses just to keep in the back of your mind. So the reason why I included this slide is not because it's so important, but this will help us determine what type of treatment we will offer the patient. So it's important for us to differentiate whether this is an intermittent or a persistent condition, and whether the symptoms are mild or moderate to severe. So always ask your patients for how many days a week and for how long does an episode last. So if it's less than 4 days a week or less than 4 weeks at a time, this is per year, then you will classify it as intermittent symptoms. Anything more than this, you will say it's persistent symptoms. Our mild symptoms, these are usually symptoms that does not cause any functional impairment, where moderate to severe symptoms, we will say this is any symptom that causes functional impairment. So whether it be abnormalities in sleeping, children struggling at school, etc., you will classify this as moderate to severe. And I will come back to this again when we talk a bit about the management. So let's jump right into our management, because this is probably the most important place where we kick in. So there are 3 factors that we can try and intervene. So first of all is environmental, and we can give certain drugs, so pharmacological, and then lastly, immunotherapy. So environmental, so here the main thing to take home is to counsel your patients properly and to give them good education on avoidance of the allergic triggers. So it's often very difficult to avoid a trigger completely, but we do give our patients advice on how to limit the exposure to triggers. So patients who are prone to getting allergic rhinitis due to, say, pollen or seasonal changes, we advise them to keep their windows closed if possible at home to limit the amount of pollen inside the house. If they do go outside, then they can wear sunglasses or glasses to try and limit the amount of pollen in the eyes. Then with dust and dust mites, we advise our patients to wash their bedding every 2 weeks in hot water. You can even advise them to get mite-proof bedding. So this is impermeable covers for the mattress or the pillow. In very dust-prone areas, you can advise the patients to get dehumidifiers. And then patients with pets, this is quite difficult. So we advise them to keep pets outside and not inside the house. If it's impossible for them to keep the pets outside, then pets can be inside the house, but preferably in an area without carpets. Keep the pets off the beds, off the sofas, off any material of sorts. And then after touching their pets, they need to wash their hands before touching the face. Then other non-specific triggers like secondhand smoke. This is something that we often see in children with allergic rhinitis where the parents smoke. So we often advise the parents to rather smoke outside, to not smoke inside the house, to not smoke in front of the child, to try and limit the amount of exposure the child has to the smoking. Certain occupational allergens, the first prize will be to completely avoid the allergen at work. But if it is impossible, then you can advise the employer to give the patient a mask or a respirator to help limit the amount of exposure. So pharmacological therapy, this is where we can sometimes prescribe medicine for the patients. So this is a nice flow chart, I thought, just to help us decide what type of treatment we are going to offer the patient. So if you have mild or intermittent symptoms, you can actually just give a second generation oral antihistamine. So the second generation oral antihistamine is something like your cetirizine or Texa is the trade name. This is what we often prescribe nowadays. It completely replaced the first generation antihistamines like your Allergics, just because your first generation antihistamines has a lot of side effects like sedation and other neurological side effects. So we prefer to use the second generation antihistamines. If you have mild to moderate persistent symptoms, this is where we add an intranasal corticosteroid. Like your Flonase, there's a whole long list of intranasal corticosteroid nasal sprays that you can offer the patient. And we often use this in conjunction with a second generation antihistamine. If you have very severe or persistent symptoms, despite being on a intranasal corticosteroid or with a antihistamine, then you can consider adding another nasal spray or changing the nasal spray. So Rhinitis is the new kid on the block. It's a intranasal spray with corticosteroids as well as antihistamines in. So you can just use that with your antihistamine or oral antihistamine. If this doesn't work, you can always add something like montelukast, which is a leukotriene receptor antagonist. And if this doesn't work, if you still have persistent symptoms, then you can consider immunotherapy. So what is immunotherapy? This is something that will usually be done by a specialist. It's desensitization treatment against a specific allergen. So here you will have to do your special investigations to determine the specific allergen. It's either a daily sublingual tablet or a weekly injection. And you can consider this for patients where nothing else works, but this will usually be determined by a specialist. So just briefly mentioning the complications of allergic rhinitis. So as I've mentioned before, you get acute or chronic sinusitis. You can sometimes get middle ear infections. And then patients might often complain of sleep disturbances in children with a blocked nose. They might have sleep apnea. Certain dental problems like an overbite can present after excessive long duration of mouth breathing. Then high arched palate might be a complication, and also eustachian tube dysfunction. So this slide I just included because I think I'm not going to talk about asthma, but I think it's so important to always think about allergic rhinitis in your asthmatic patients. So in 90%, this stats comes from the UK, but 90% of the patients with asthma in the UK also has allergic rhinitis. And in approximately 30% of the asthmatic patients, they are undiagnosed allergic rhinitis patients. And then also in treating your allergic rhinitis symptoms and triggers, asthmatic patients have about an 80% decrease in exacerbations of their asthma and hospitalization. So if you ever see a patient with asthma, always have a high index of suspicion for allergic rhinitis as well. If they are not on treatment, always ask about symptoms and possibly start treating them for that as well. So let's get back to Mr. A. So we diagnosed him with uncomplicated persistent allergic rhinitis. We counseled him extensively on trigger avoidance most probably the dust and the animals on the farm. And then we also pharmacologically started him on a 2nd generation antihistamine. We gave him a script for cetirizine, and then also Flonase, which is a nasal corticosteroid. We told him to follow up with us if there is no improvement on this specific treatment, and then we can consider doing lab tests to identify specific allergens and then adjust our treatment from there. And that's it from me. Thank you very much for your time. So just the references that I've used, and then if there's any questions, you guys are welcome to ask.
All right, super. Thank you very much, Dr. Eksteen, for that informative and in-depth presentation. Yeah, so if you guys have any questions, please feel free to raise your hand or type the question in your chat field. In the meantime, I'm just going to connect here as well with the iPad to show you one or two other things. Yeah. Okay, let's see, I'll show you. I'll do a screen share on my side. For those that's not quite familiar with the operating of the iPad. So yeah, within the, this actually looks a little bit different though. So you should have on the iPad, if you click on the screen once, there's a raise hand. It will look a little bit different on your screen though, option, and as well as the chat. So you can type there, or if you raise your hand, I can open the floor that you can actually speak. But while you are still thinking about that, and a couple of questions perhaps, especially now with the load shedding, we do have had experiences that quite a few of you have lost connection, or the iPad struggled to connect to the internet and such. When two factors here. Firstly, if you look at the top right-hand side of your screen, where you see the battery percentage, right next to battery percentage, you should have indicators stating your connection. So it should say, so just left of that 13% battery, you should have your either 4G, LTE, or 3G connection that it states. If not, if there's nothing there, then you can follow the following steps to get your device connected again. So first and foremost, what you can do is, just to quickly show you also, this is the buttons on the iPad. So if you refer to your home button, it will be the big button here to your right, where it says home button, and you see there with that red arrow, home button. So if you click on that button once, if you click on home button once, it will take you to the apps. If you click on home button, if you say you're there, if you click on the home button once again, it will take you to the very first page. So you have 2 pages of applications, and the rest of the buttons, it just indicates there. Just a quick one here. I see there's a chat. Let's just quickly. Don't know if you see that, Dr. Eksteen, on the chats bar. So just, does Allergard nasal spray provide protection to allergies?
Yes, so Allergard is one of the nasal sprays that we can use as a preventative measure to try and prevent, especially in your persistent symptoms, you can give this to try and prevent the inflammation or decrease the inflammation in the nose. So yes, it does, I don't want to say protect against allergies, but it sort of decreases the inflammatory response your body and especially your nose has towards specific allergens. So this is always a good, or you can use it, it's a good way to decrease the amount of symptoms that we often get with allergies.
Okay, super. So that answers the question. If not, just state it again. So to go back to the iPad, just if your iPad is set up correctly on the stand, it should be in this configuration where your home button is then to your right, and on-off button is on the top left, and the volume button right on top to the left. Okay, so just to go back here, so should you have connection issues, you go to your home screen and find your settings menu app. It looks like that. So top left on my screen currently, yours might be a different screen. So click on settings, and on airplane mode on the top here to the left, if you're looking at that section there, on the left hand side, right on top, so it says airplane mode. Click on that so that that little slider goes green. Wait about 10-15 seconds and click on it again so it goes gray, and then have a look again on the top right hand where it says 14% battery of the screen, 14 right at the battery percentage, top right hand screen side. It will then search for connection and then just check if it does give you a 4G, 3G or LTE connection. That should work. Otherwise, you can just give us a call to assist you in that connection problem. So don't send any patients away. Please do contact and we'll make a plan. Just a quick one here. There's two more questions there. I don't know if you see that, Dr. Eksteen.
Yes, I've seen them. So the age that we can use Allergard, so usually I think the Allergard is only from 12 years and older where you can use it. For children under 12, we usually give something else like Flixonase is usually the most commonly prescribed nasal spray or nasal drops that we give to children, just because there's a lot of data to support the reason for using it in children. So Allergard, there's not a lot of data, so I'm sure the ingredients shouldn't have too much an effect on children, but there's not, like I said, enough data for us to motivate for this. And then it was also asked whether it's safe during breastfeeding, because it's locally used. So the nasal spray only, it's usually the effect stays locally in the nose. So it is safe to use during pregnancy as well as breastfeeding. Usually if you take your oral corticosteroids like your prednisone, those are the medications that will have systemic effects and be secreted in the breast milk, but nasal spray should be okay. Not all of them, but the Allergard is safe in pregnancy and also in breastfeeding. Hope this answers the questions.
Yeah, great, thank you. Any other questions or queries? You're also welcome to stay. If you have any questions around the platform itself, the UDoc platform, you're also welcome to ask any questions around that. So that's just a quick one regarding the connection problems. So just that you're also aware, even if there's if you are completely unable to load a patient or assist a patient whatsoever, and it's for certain cases where you are possibly not required for assisting in that consultation, you can actually state to that patient, so something like if it's just going to be a repeat prescription or such that they require, that patient can create their own profile if they haven't used UDoc before. So just again, when you create a patient, or if the patient already exists, this login email that you should obviously ask the patient for their own email, this login email is actually their username. So this is what they will use when they need to log in. So if they when they go into the UDoc platform, they will also come to a login screen similar that you have, but this is now for their personal account, and it's that email address that they're going to use there with the password that was created for them when you actually created that particular patient. So just bear that in mind. So then they will have to pay on the platform directly and not at the teller or so, but then they can still get that repeat prescription and send it through directly to the pharmacy and just get it at the pharmacy, the medication. So that is the other option, or the alternative there. So that is now if you are obviously completely unable to load or consult the patient online. The same thing if you go to a patient on any of the existing patients, if the patient is unaware or not sure that they are able to log into their own profile, you can just search for that patient, say it is this guy. Then you can just search for the patient, find the patient, and then you can automatically look at the email here, and that will be the login email to that patient's account that they can log in on their own device or phone or what have you, and even consult with the doctor if the need arises, but they will also then be able to do that repeat prescription option. So then they can do everything by themselves. So that is that. If they don't have their password, and obviously then, yeah, that will be the easiest whenever you do create a new patient. When you're at this stage, as mentioned previously, the mobile number that you will enter here, you can just, if you click on after you've typed it, if you click on it again, you can click select all, you can click copy. So just use then the mobile number for that particular profile's password. So you click on that blank field to enter it, click on it again, and you can click paste. And then you just paste that cell phone number then as the actual password for that profile. This is now if you're creating a new patient. So in most instances, you can get them this email address for them to use as their username to log in, and tell them that their password is most likely their cell phone number. If not, they will be able to type in their email address, but it needs to be a real email address or their true email address. And then they can click on that forgot password option, and that will, then they will be able to reset it, but it will send an email through to them to actually complete the process. So, and then you can also assist in creating a new password and also update that person's email address should the need arise. So again, let's just clear this field where we have a patient that comes in. Name is Crystal, so you're going to search for Crystal. There we go. You click on the patient's name, and then you can just ask the patient confirm if that email address is in fact correct. if that email address is not correct, you are able to edit this at this point. So you can change that to whatever it needs to be. And you can then also, if you go all the way down, you can change that password then to whatever for that patient. The patient consents to that, and you just click submit. On the left, you'll get the message to say successfully updated patient, and you can carry on. Should your iPad have been giving you issues with connections and that, you are able to do all of this actually from your clinic PC as well. The only restriction, obviously, on the PC is you won't be able to do any video calls with the doctor, since you do not have a microphone nor a camera or speakers. So you won't be able to do that, but all the other functionalities you will have via the computer or PC in your clinic as well. So if you do have, obviously, internet connection on your PC, but unfortunately not on your iPad, then you can still assist. But yeah, so that's just a different aspect of it. If you need to assist a patient, then in order for them to go into their own profile and pretty much help themselves. Just quickly, is there any other questions regarding the presentation or the or regarding the platform? Again, you're welcome to ask. I'm just going to carry on with one or two other aspects. So that was that. See. Okay. There was one thing on the creating of a patient. When you do create a patient and you have selected the sign up with medical aid, excuse me, and you have to select, you have selected the medical aid option and you've typed in the medical aid scheme and, you know, codes and what have you. If you get an error message, or even if the system doesn't want to, it doesn't find that person or such, and if you go the manual route, then after that, when you deselect that and actually entering the name and such manually, if you still get an error with the medical aid option, also every time make sure that it has been deselected after you filled in that the fields, and you're still getting a medical aid error, just remove that at the bottom where it asks in the medical aid. And in order to do so, you click on medical aid, you go all the way to the top, and you select that dash so that it is blank again. And then you also need to clear the aid number, and then it should accept that that profile or that patient. That's just another quick thing that has arisen one or two times. I don't know how many has experienced that problem. Okay, so that is just a quick other aspect. Let's see. And just to recap briefly, obviously, when you do go to your on your PC in order to print any documentation or to resend your email documentations to a patient, log in with your same credentials on the on your clinic PC or computer, and then once you've logged in, you will go to consultations at the top left. Click on consultations and you'll find all the patients that've been through your clinic. Next to any of the names, you will be able to see, let's say the second from the top, Jan. Click on preview next to the name. It will change the name in the middle column to that person. And on the right-hand side, you will find the buttons again in order to email any documents. But please note that if this message is here that says sick note has been sent to that specific email address, please note that it has been sent, so it will not help to send it again. But what you can do is obviously confirm that that email address is correct. If not, you can just email it to and change that email address. So firstly, we're going to say send sick note. So you click on the button sick note. And on here, you can just basically go and edit that email address. So say that 2 pluses shouldn't be there. You just take that out, click submit form, and it will say document sent. Now, don't stress about it showing again the same email address, because that is actually what is on their profile. So once the document has been sent, that you've edited the email, just click then cancel, go back, and you will see or notice here that it has sent that document through to that email that you have altered it to. Now, if that actual email address has changed for that patient, so that it is now the email address that it should be, you can now go also and update that patient's profile details. So if it is Jan Anneman, you go to click on, you go back to home, then you search for Jan Anneman. You will see there he is on the top left, and there's the email address also, the 9L++. So you click on Jan, and there you can go and edit that patient and change the email address to the correct one, and pretty much just go down and click submit, and it will update that email address as well. So just bear that in mind as well, and with the functionality there, you can do those functionalities and update profiles and such. And yeah, so that should be covering quite a bit there. I hope that helps in patients going forward. And the retrieving and sending of documents. And just briefly again, on your clinic PC, if you go to consultations and you actually want to print it physically in the clinic, you are able to do so. So just click on the patient's preview option, make sure that at the top that it has changed to that patient that you are looking at. And when you go all the way down to the bottom, you will find the documents here underneath the heading forms. So in order to print it on the PC, you just click on that PDF next to, so say we want to send the sick note, you click on PDF next to it. It will open up the document and you can print it directly from this page, obviously while on the PC of your clinic, your computer. So you won't be able to print from your iPad. This is only from your computer. So that's just covering that. Should you have any drug require or drug changes or any issues regarding the medication that was issued, please get the pharmacist to contact the doctors directly if the need arises to make any changes to that. So if there's anything out of stock or such, and there's an alternative needed, they can just get the pharmacist then to contact the doctor directly, please. They will find the details on the the prescription itself. So the doctor's details are on that. So yeah, no, great stuff. Thank you again, guys, for joining this presentation. It was quite informative. Thank you, Dr. Eksteen, once again. I'm sure everybody found it most informative, and should there be any other queries or so, we will pass it on as well and take it from there. So thank you very much, everybody, for your time today, and we'll see you next week with another presentation, and we'll update you and keep you guys posted. Thank you for the good work, and thank you very much, Dr. Eksteen.
Thank you. Have a good day.
Likewise. Bye, guys.